Colon cancer is a formidable foe, often silently lurking within us, unnoticed until it may be too late. Imagine Sarah, a vibrant 55-year-old who dismissed her persistent fatigue and occasional abdominal discomfort as simply signs of aging. Tragically, Sarah's story is not unique. Colorectal cancer is the third most common cancer diagnosed in the U.S., claiming tens of thousands of lives annually. This silent killer often presents no noticeable symptoms in its early stages, making early detection crucial. But there is hope. Recognizing the often subtle warning signs can significantly increase your chances of successful treatment and survival. Don't let it be too late. Do you know the 8 critical colon cancer symptoms you should never ignore? Understanding these vital signs could save your life or the life of someone you love. Let's explore them together, empowering you with the knowledge to take control of your health. Colorectal cancer, often simply called colon cancer, develops in the colon or rectum, the final sections of your digestive tract. It begins when healthy cells in these areas mutate and grow uncontrollably, often forming a mass called a polyp. Not all polyps are cancerous, but adenomatous polyps in particular have the potential to transform into malignant tumors over time. Understanding your risk factors is crucial for prevention and early detection. Age is a primary risk factor, with the vast majority of cases occurring in individuals over 50. However, we're seeing a concerning rise in cases among younger adults, highlighting the importance of awareness across all age groups. A family history of colon cancer, particularly in a first-degree relative, significantly increases your risk. Specific inherited genetic syndromes, such as Lynch syndrome and familial adenomatous polyposis, FAP, also dramatically elevate the risk and often lead to earlier onset of the disease. Beyond genetics, lifestyle choices play a significant role. A diet low in fiber and high in red and processed meats, combined with a sedentary lifestyle, can contribute to the development of colon cancer. Obesity, smoking, and excessive alcohol consumption further amplify the risk. Chronic inflammatory conditions of the bowel, like Crohn's disease and ulcerative colitis, also increase the likelihood due to long-term inflammation and cellular damage. Regular screening is the most effective way to prevent colon cancer or detect it in its earliest, most treatable stages. The American Cancer Society currently recommends that average-risk adults begin screening at age 45. This age recommendation has been lowered in recent years due to the increasing incidence in younger populations. Several effective screening methods are available. A colonoscopy allows direct visualization of the colon and rectum, enabling the detection and removal of polyps before they become cancerous. Stool-based tests, such as the fecal immunochemical test, FIT, and the stool DNA test, Cologuard, are less invasive options that can detect hidden blood or abnormal DNA associated with cancer. Your doctor can help you determine which screening test is most appropriate for you based on your individual risk factors and preferences. Early detection is paramount. When diagnosed at its localized stage, before the cancer has spread, the 5-year relative survival rate is around 91%. This drops significantly as the cancer progresses to regional or distant stages. These statistics underscore the life-saving potential of timely screening and prompt intervention. Don't wait for symptoms to appear. Talk to your doctor about colon cancer screening and take proactive steps to protect your health. Let's delve into the 8 crucial colon cancer symptoms you should never ignore. Remember, these symptoms can also be indicative of other, less serious conditions. However, experiencing any of these warrants a conversation with your doctor to rule out colon cancer and ensure appropriate treatment. Bright red blood, often visible on toilet paper or in the toilet bowl, hematochezia, typically suggests bleeding in the lower part of the digestive tract, such as the rectum or anus. Common causes include hemorrhoids, which are swollen blood vessels, and anal fissures, which are small tears in the lining of the anus. While these are usually benign and treatable, they should still be evaluated by a physician. Darker, tarry stools, melena, often indicate bleeding higher up in the digestive tract, potentially from the colon. Colon cancer can cause bleeding as the tumor grows and damages blood vessels within the colon wall. This bleeding may not always be visible to the naked eye and can sometimes only be detected through a fecal occult blood test. A key difference is that hemorrhoids and fissures often cause noticeable pain with bowel movements, while bleeding from colon cancer can be painless. Any instance of blood in your stool, regardless of color, quantity, or associated pain, requires prompt medical evaluation to determine the cause. Bloating, gas, and a feeling of fullness can also accompany the pain. Many other conditions, such as irritable bowel syndrome, IBS, diverticulitis, inflammation of small pouches in the colon, and gastritis, inflammation of the stomach lining, can also cause abdominal pain. It's crucial to differentiate between these. IBS pain is often relieved by bowel movements, while diverticulitis pain can be severe and accompanied by fever. Colon cancer pain, however, tends to be persistent and may worsen over time. Pain that is new, persistent, worsening, or accompanied by other symptoms like changes in bowel habits or unexplained weight loss should be promptly investigated. A significant, unexplained weight loss, generally defined as 5% or more of your body weight within 6 to 12 months, warrants medical attention. Colon cancer can cause weight loss through several mechanisms. The tumor itself can interfere with the body's ability to absorb nutrients from food, leading to malnutrition. Additionally, the body's immune response to the cancer can increase metabolism and calorie expenditure, further contributing to weight loss. If you experience significant and unexplained weight loss, consult your doctor to determine the cause. It's typically described as persistent and overwhelming exhaustion that significantly impacts daily life, making even simple tasks feel draining. This debilitating fatigue can stem from anemia, a condition often caused by chronic, often undetectable blood loss from the tumor in the colon. The resulting iron deficiency impairs the blood's ability to carry oxygen throughout the body, leading to fatigue and weakness. Common symptoms include fatigue, pale skin, shortness of breath, dizziness, and cold hands and feet. In the context of colon cancer, chronic bleeding from the tumor can lead to iron deficiency anemia. Diagnosing anemia typically involves a complete blood count, CBC, to measure red blood cell levels and hemoglobin concentration. Further tests, such as iron studies, can determine if iron deficiency is the cause. While it can be caused by benign conditions like hemorrhoids or anal fissures, it's also a potential sign of colon cancer. Bright red blood is often associated with hemorrhoids or fissures, while darker blood could indicate bleeding from higher up in the colon. Persistent rectal bleeding, regardless of color, accompanied by changes in bowel habits or other symptoms, requires immediate medical attention. While occasional constipation is common and can be related to diet, dehydration, or certain medications, chronic constipation can be a symptom of colon cancer. A tumor growing in the colon can partially or completely obstruct the passage of stool, leading to constipation. A noticeable and persistent change in bowel habits, especially towards more frequent or severe constipation, warrants medical evaluation. While often caused by infections or dietary issues, chronic diarrhea can indicate a more serious underlying problem. A tumor in the colon can irritate the lining and disrupt normal bowel function, leading to persistent diarrhea. Diarrhea accompanied by blood, mucus, or other concerning symptoms should be immediately investigated. It's important to remember that experiencing one or more of these symptoms doesn't automatically mean you have colon cancer. Many other conditions can mimic these symptoms. However, these symptoms should never be ignored. Early detection is crucial for successful treatment of colon cancer. If you're experiencing any of these, schedule an appointment with your doctor promptly. They can perform the necessary tests and examinations to determine the cause and ensure you receive the appropriate care. We've covered 8 critical colon cancer symptoms: blood in the stool, abdominal pain, unexplained weight loss, fatigue, anemia, rectal bleeding, constipation, and diarrhea. It's crucial to remember that these symptoms can also be caused by other, less serious conditions. However, ignoring them could have serious consequences. If you're experiencing any of these, especially in combination or if they persist, please don't delay. Schedule an appointment with your healthcare provider. Early detection is the cornerstone of successful colon cancer treatment. When found and addressed in its early stages, colon cancer is highly treatable, and the chances of a positive outcome are significantly increased. Knowledge is power. By being aware of these symptoms, you're taking a proactive step towards protecting your health. Don't keep this information to yourself. Share this video with your friends and family, helping to raise awareness about colon cancer and the importance of early detection. Stay informed about advances in colon cancer prevention, screening, and treatment. Subscribe to Heart Victory for more valuable health information like this, so you can stay empowered and take control of your well-being. We provide regular updates on various health topics, including cancer prevention, heart health, and more. Hit the notification bell so you don't miss out on our latest videos. Reputable organizations like the American Cancer Society, the Centers for Disease Control and Prevention, CDC, and the National Cancer Institute also provide valuable resources and up-to-date information. Your health is your most valuable asset. Take control of it. Early detection saves lives.